right, good morning, everybody. As we all know, we are coming in today to vote. Finally, the legislature will have a say on whether or not to extend the governor's executive orders in a number of areas. And I first want to point out that Tuesday was really a historic day in the state of Connecticut. It was actually the first public hearing that we had where individuals were able to have a say on how we should be managing the COVID pandemic. It's pretty remarkable to me that when this pandemic started in March of 2020, it has been managed by the executive branch without any input from the public since then. And so Tuesday was the first time we were able to hear from individuals. And as you all know, despite there being a number of orders that are being renewed, the debate really revolved around masks in school. And why is that? Because all along, Republicans have been saying there's more to this discussion than just the transmission of COVID, that we need to take other considerations into play. The educational impacts on children, their socialization impacts, their mental health, their physical health, and yet none of that has been heard around this building until then. And what was also interesting is the governor, for a number of weeks, have said that he wanted the legislature to weigh in on this issue. Yet, very soon before that public hearing, the governor took that opportunity away and declared that masks were going to be removed on February of 28. None of this has anything to do with science. And I think, as Governor DeSantis said, this has more to do about political science than real science. When we look at the science, it paints a very different picture. You know, for months I've been asking both the State Department of Education and Public Health about the transmission rates in schools. I finally this week got a letter from the commissioner. And not only have they never collected the data on transmission among children in schools, they asked that if I was interested in the data from schools in my district, that they would recommend that I reach out to the school districts directly. To think that our agency that is in charge of overseeing a pandemic hasn't even taken the time to see how this virus transmits among children is alarming. And on February 7th, in fact, the CIAC, who governs our sports, youth sports in schools, have requested that masks be removed from all athletes participating effective Thursday, today actually. And the reason being, because they've been tracking the transmission for the last year in school sports. What they found in the 20 to 21 year, and these were even before our children were vaccinated. So vaccinated and unvaccinated individuals, there was less than 0.1% of cases traced back to athletes. That was out of 15,000 participants in winter sports. And so what I am imploring today, that when these votes are taken, that the Democrats look at all of this data that we have before us. Because if there is such little transmission, what are the impacts to our children? On a global scale, research has suggested, and the World Health Organization states that they do not recommend that children under the age of 5 be wearing masks because of the potential impact of wearing a mask on their learning and psychological development. That's from the World Health Organization. That's science. The CDC also, their studies have been inconclusive on the mandate for students wearing masks in school. Brown University had a study from 2020 to 2021 school year in New York, Massachusetts, and Florida. They found no correlation between students masking versus getting COVID. No correlation. The United Kingdom had a study finding the same thing, that there was no correlation between wearing masks and not wearing masks in schools. Scientific American found that wearing masks in school can hinder language and speech development among younger children and students who do not speak English. The National Library of Medicine found that wearing masks impedes emotional recognition among children. So it was no surprise that we had hundreds of parents coming forward testifying against these masks. Why? Because children relatively are not impacted by COVID, but they have already seen the emotional and educational impacts that it has had on our children. And so what we do find upsetting today with these executive orders, that while there is a claim that we're going to be removing masks by February 28th, it is still continuing the same authority with the Office of Early Childhood, the State Department of Education, and the Department of Public Health in determining whether or not masks should be placed on or off children's faces up through June 30th, 2022. And when I look at all the science that we have before us, that these agencies have not provided one shred of science either way, that they should not be given this authority. It just should not continue. And as all the other states we're seeing that are removing masks on children, I would implore the state of Connecticut to do the same. And so our caucus stands here to support an initiative where parents going forward should have the option of whether or not their children wear a mask in schools. I don't believe that these decisions should be left up to individual local districts where they're going to be left to try to find science on their own because this state of Connecticut has failed to provide any guidance to them. It's not fair to our superintendents. It's not fair to our Board of Education. It's not fair to our teachers. But what we do now, the time has come for our children to get back to a normal life like so many of us have already been leading for the last year. Remove the masks on them. If parents want to continue to have masks on their children, that option can be provided. And we'll be offering that amendment today. And with that, I'd be happy to answer any questions. So if the mandate is removed, a parent would have that option. Our concern is that the state could reimpose a mandate or a school district can impose a mask mandate, and then children will be forced and not able to have an option. And I think that this is not only problematic for the schools. You know, we have to consider our daycares that are now being put in a horrible position of whether or not they should put masks on children or not. You know, they're private companies, and they are now stuck with having to figure out this debate. Why? Because we have failed to have any leadership coming out of Department of Public Health to explain to people how masking, when it is appropriate and when it's not. And if anyone has gone into a daycare setting or with young children with these masks, it is an absolute joke to think that these masks that are falling off their faces half the day because they don't even fit are providing any level of protection. So, I mean, there are many other issues on the other orders that will be fleshed out. You know, we do have a concern on the mandate of boosters on our health care, in particular the nursing home. Staffing levels alone are going to drop. And my concern is that we're going to create a crisis. The governor is going to create a crisis in our healthcare just by the loss of staffing. You know, it doesn't take into consideration individuals that just got COVID and they want to wait 90 days to get a booster, which is the recommended time period to wait to be boosted. This construction doesn't give them any flexibility. And so these draconian rules aren't appropriate anymore. We are not in the middle of a pandemic. We are coming out of it. And we need to show reasonableness with the state of Connecticut, even from a mental health perspective. The continuing of fear-mongering isn't good for the state of Connecticut, and Republicans want to bring balance back to this conversation.
Is the booster mandate the one that is in nursing homes? That's on the
That is correct. And I think the language coming out today may be extending that into March now. But we still believe that's not enough time. And if the orders are going away on April 15th, what are we really doing here? Why are we getting involved in these healthcare decisions when they're almost on the horizon of expiring anyway? Well, I mean, we have certain executive orders that are still going to be extended to help manage the healthcare system. And I think there are many that we do support. But I said certainly the mask mandate is getting the most attention because it's impacting so many children's lives. And again, on Tuesday, it was the first time those individuals were able to let their voices be heard. But we are certainly hearing from our nursing home workers, our teachers, our healthcare workers that are concerned about these continuing mandates that are only being imposed on them and no one else. Well, I think for me, the right decision is to be removing these masks. We're seeing it on a national basis. When you look at, there's a chart that has compared the the COVID rates of Arizona and California. California with a mask mandate, Arizona without. And the tracking is absolutely identical from infection rates to it dropping off. So it really begs the question of how effective these cloth masks are at blocking particles. I mean, maybe for 10 or 15 minutes it might be effective, but if you're in a room for a couple of hours, there's probably going to be a spread. And I think we should continue to rely on the vaccines and the natural herd immunity that's occurred. We're seeing everything flatten. No matter how hard people are rooting for more variants to scare everybody into submission, we're not seeing that happen. And so the quicker we could get out of this malaise, the better off our society is.
Will the money be there for the learning loss? Will the money be there for the learning loss?
Well, we have to have that conversation this year because, the commissioner talks about testing scores. We don't have the data this year, but I will say, and it is anecdotal, but it's closer to science than what I'm hearing out of their mouths. When I talk to educators, I had a teacher in the Branford school system who said that her third grade class is reading at a first grade level, 75% of her kids. Over and over and over again, I'm hearing that from elementary teachers. My wife is a daycare worker. She tells me how behind they are in trying to teach the kids because they struggle with masking them. So we really should have taken the approach of what is the least restrictive ways of educating our kids. And government was able to keep this dark secret suppressed because there were no public hearings. Now that we're beginning to have them, we're starting to see the educational impacts of masks, and I think it's going to need to be part of the conversation this session. Yeah, I think coming up, we need to address that rule. And I think by March 1st, this building needs to reopen and we need to get back to normal. I mean, there were many legislators that attended the XL UConn basketball last night, myself included. We are all going about our lives normally. We're socializing. Legislators are holding in-person fundraisers. If we could engage in that activity, we certainly could get into a conference room and hold a committee meeting and make ourselves accessible to the people that are impacted by those decisions. So this needs to come to an end. We've been patient. We are still dealing with these guidelines through February in the virtual world, but come March 1st, things need to look different around here.
Potentially eliminating the 180-day school requirement. What are your thoughts on that? It seems like there's some COVID days that would be allowed to even be taken in advance, scheduling days.
So I'm against that proposal right now, and I hope it changes. Again, to just carte blanche allow districts to cancel school days because they want to. even if it's for COVID, we have to have a deeper conversation. So I think what we need to do is hear from our school districts if they need extra time, and we could handle it accordingly during session. But I'm generally concerned that we have really taken a flippant attitude toward districts, and we need to drill down. Children shouldn't be losing any more class time, so I don't think that waiver should move forward either.
Are you going to be offering any other amendments today besides the one you spelled out?
There may be amendments offered. Our caucus is going to meet and have a discussion. Like I said, we're very concerned about these forced vaccine mandates on these workers where no one else has those. And so that'll be part of our conversation. I believe it's in the current bill that was released last night that moves it to, I think it was March 7th. So that has occurred. But I do think we need to have a broader conversation about it, because I'm not sure that solves the problem for nursing homes. And when you listen to the public hearing on Tuesday, there aren't a lot of answers to what if. You know, what if 40% of the workforce walks out? What are they going to do? And the administration sort of shrugs their shoulders. Now, we knew what happened with Department of Corrections. Many of them didn't get vaccinated, and they weren't able to shut down the prisons. They just let them violate the rule. So if you're putting in place a rule that's not workable, I would suggest then that's a rule just for optics, and we should be getting rid of it altogether.
The school boards are handling the schools. Are the town councils going to set the rules for the daycare? Or how is the daycare going to know what to do?
Well, I mean, I think each individual daycare may be left up to their own devices, unless a selectman or a mayor imposes it themselves on all businesses, which is possible. And I just don't believe that we are at a place right now where these type of mandates need to be issued on our cities and towns. I mean, I think there are pockets of Democrats that are concerned about extending orders. I know we had a number of votes back in September to not have the broad extension, and we'll see where they are today. But certainly now that the public has shined their light on this, I think it gives everybody a little bit of pause. Maybe now there's a little bit more deliberation, which I think is good. And I'm hopeful that some of our ideas will move forward. You know, we had made the remarks months ago, I think in July, that you didn't need a gubernatorial declaration in order to get the federal SNAP benefits. And those remarks were dismissed. Well, guess what? Today, we're voting on a legislative declaration in order to get the SNAP benefits. What we were saying 6 months ago was actually, in fact, the truth. And the Democrats said, no, you're wrong. We need this gubernatorial declaration. So there hasn't actually been an honest debate of why we have these authorities continued. And I think when Democrats start realizing that all of this hasn't been so straightforward, I hope we see some no votes today. I think there are continued remarks that we hear that variants might pop up in the future. Therefore, we need these powers, we need these powers. And I will say, if there is another pandemic that rises up again, we could declare an emergency all over again. The thought of a possible pandemic in the future should not give rise to a perpetual state of emergency declarations. And that is the last argument they've been left with to try to hold on to these type of powers. And what's gross to me is that we continue to see different proposals come forward that have nothing to do with managing COVID. I mean, one of the items that's being snuck into this bill today that wasn't part of the governor's request is to continue the CT Unite program that have impacted our landlords and impacted property values through the state of Connecticut. And all of a sudden, out of nowhere, we're going to try to extend this program? What does that have anything to do with a virus?
Where do we stand in terms of the revisions to the two emergency statutes? that's something that is going to come up on March 1st. You know, the old laws take effect, and the governor could issue an emergency declaration the next day.
That's right. So on March 1st, that bipartisan bill that required legislative input to any declaration goes away. The old law is that the governor would have to make a declaration himself. The 6 leaders and the public health leaders would come together and take a vote, and it would revert back. I am highly disappointed, and that's where we are. Part of that bill had a task force, a bipartisanship that was supposed to work on the underlying statute to fix. Those meetings never took place, and in fact, it's my understanding that the chair just issued a recommendation unilaterally on what fixes he would like to see in that statute without any input from the members that we all appointed to that commission. It is a complete slap in the face to this process. This is why the building needs to be reopened, because we don't write legislation by individuals. We write it through a public process, through a deliberative process, through committees. We are not going to do this in people's living rooms.
So I guess then you have not been approached. I guess you haven't been approached about discussing what sort of divisions to make the timetable on legislation.
No, that deliberative process has not been respected. Thank you.